My name's Dr. Umesh Patel. I'm a preventative cardiologist. I have had the pleasure of using BioSlice Slim both personally and in my practice. I have been delighted with the results I've achieved in both spheres of my life. Personally, it has made me feel healthier, more alive. As far as my patients, I've never seen a product that can accomplish multiple goals, including lowering cholesterol, lowering blood sugar, helping reduce weight, helping blood pressures come down, and a product that actually tastes good and the patients are willing to take. So it is indeed a remarkable product, and I use it freely on both patients, family members, and the general public. I introduced BioSlice Slim to my practice, and what had happened after a few months, I started getting checks from the company. And my first thought was, this is a mistake. There's no company that ever sends me a check without my bill. So I called Unicity and they said, no doctor, this is actually an honorarium because you're using our products. And I said, oh, well, that's good. I love your products. I'd use them anyway. And I realized that if this was an income stream, it would help offset the massive cuts I'd just been handed out by the government and the insurance companies. And at that point, I was debating whether I should close down my practice or cut staff benefits, take away the health insurance, take away the hours. And I saw that this was a potential for saying no to either of those and continuing practicing medicine. And over the last year, I have been able to generate replacement income for all the cuts that I've endured. And the good part of this is that it has allowed me to practice in the style I was trained 35 years ago, which is patient first and the business comes second. And that has always been my way of practicing, and I love the fact that I'm not going to be bullied by anybody to hurry up and not talk to patients. I can spend 20 minutes with a routine patient, an hour with a new patient, and of course I get to know stuff about their health and their well-being, which allows me to keep them alive and well even longer. And ultimately, that extra time I spent keeps them out of the hospital, and so it reduces healthcare costs. In my humble opinion, this product should be given out free on the street corner to every person in the United States. Thank you.
Hi, my name is Annie Varghese, and I'm an interventional cardiologist from the great state of Texas. And I have been using the BioSlice Slim product in my patients for about a year and a half, and I had no idea of the benefit that it would provide for the patients with regard to cardiovascular disease risk reduction in my patients in the United States. But it took on a greater role, actually, as we were able to take this product to India. India being a country of about 1.3 billion people, and as I told the CEO of Unicity, Stuart Hughes, I said, Stuart, there are people dying from cardiovascular disease in India, and why don't we initiate this product there? Because of the terrible problem with diabetes and heart disease, people dying at a rate 4 times the risk of any other population. Stuart thought that was a fabulous idea, and it has made huge changes in the lives of people already, and it is going to be a wonderful saving mechanism for the people of India. Now let me tell you about the BioSlice Slim franchise, because as physicians, we're so used to just writing a prescription, taking care of the patients one by one, not really reimbursed for our efforts as we were trained to do. And it's becoming a problem for physicians. My friends are having to close their doors of their practices, and they're fabulous doctors. And I thought, how can we change the lives of physicians, these people who have struggled for 14 years, 15 years, given their life for training, another 15 years of practice, and now to find that they're not going to be reimbursed for their efforts in their jobs. So when I thought about it, I thought, wow, this Unicity franchise would be a fabulous addition to their practice as a source of revenue, to keep the doors open, to keep the lights on, to pay their staff, to save lives Because what we do is save lives, and if we go away, then who's going to take care of the people? Who will take care of the diabetes and the cardiovascular disease? Who will open those coronaries in the middle of the night and put stents in? It's us, and if the world loses us, then there'll be much more disease and much more death. So here's a product that's simple, fiber and vitamins. You give it to the patients, you give them physical health, and you give the physicians financial help. And that's what we need to give as a message to all physicians over the United States and all over the world, because this product is in 26 and now 27 countries, including India.
Hi, I'm Pedro Antonio Serrant. I'm an internal medicine physician in the community of Slidell, Louisiana, which is a community outside of New Orleans. The impact that BioSlife Slim has had on me, I have been able to lose weight, lose inches personally, and my patients started to see that on me, and they started to say, wow, what are you doing? And I had to share it with them. So my impact actually, the emphasis on my patients is that I want to make them healthier. I want to make them try to enjoy what they do every day in their life, but they be able to live longer and try to enjoy their family much better. And when people are overweight and having issues with diabetes, metabolic syndrome, cardiovascular disease, their quality of life is definitely impaired, and they cannot enjoy with their family the way they enjoy, not only in the eating and the family reunions and food, but also just being active with them. They cannot play with their children, and that's a shame to see someone that cannot enjoy his family. Normally, there's not a lot of medications that can do, and these are prescribed medications with approval from the FDA that cannot increase that HDL the way that Slim does. You know, these numbers are really something that you need to see them to believe them, and to see those on me, then you make me a living poster. I can talk to my patients with a lot of freedom and a lot of commitment that they're gonna be able to get a product that is actually good for them. Recently, we've been experiencing a decrease in reimbursement in medicine. I have questioned myself many times, do I need to reduce the staff in my office? Do I need to cut salaries? Do I need to reduce their bonuses or their incentives that I give them? BioSlife Slim has allowed me to not need to do that, and has allowed me to maintain the staff with the same benefits, give them some extra encouragement, because I do use part of the incentive program that I have in my office. As well, I have a much better environment when we know that these employees are not going to have to get a second job and supplement their income, because I don't have to reduce their hours.
I'm Judy Gilman, and I'm a nurse practitioner and a certified diabetes educator. And I am just so impressed with what BioSlife Slim does for people with diabetes. I've spent over 30 years specializing in diabetes, and for especially type 2 patients, they are seeing such good improvement in their blood glucose levels that many of them are able to reduce dosages or even come off their orals. Some people are able to reduce their insulin doses and come off insulin. It's just been an amazing benefit to them, because as we know, so many of our diabetes medicines cause weight gain. And not only that, but in addition, they struggle with dyslipidemia. Their lipids are improved, and of course, as their weight comes down, their insulin sensitivity continues to improve. It has just been an awesome treatment for my patients with diabetes. BioSlife franchise has just afforded me the great opportunity to start my own business, continue to educate people, which is what I really enjoy doing, and at the same time help them with their health. It's given me all of those benefits of being my own boss, being able to set my own hours. I have had financial rewards that have allowed me to do many things that I would not have otherwise been able to do. I've had some amazing trips with the company. I have been to Bangkok, I have been on the cruises. The company rewards us very well for the work that we do. I strongly encourage you, if you're a healthcare provider, to consider becoming a BioSlife franchise owner.
My name is Dawn Graubert. I have a master's in special education. I have 2 grown children, and I first learned about Slim just from somebody in the community, and I heard about all the wonderful benefits, And I met with her and I said, I will buy 5 boxes of Slim. And she said, no, your husband is a physician and your father's a pediatrician. Let's set you up as a healthcare franchise owner. And we did, and within 2 weeks we had sold 29 boxes of Slim. It is now in my husband's physiatric practice where he's using it to help with weight reduction for his joint pain patients and his back pain patients. And I'm also the manager of a pediatric practice where we've been using it primarily with our Medicaid patients for childhood obesity and helping that epidemic. The parents are loving the product because it's become a whole family product that they can use. It's a do no harm product is what we like to call it. Our children have been using it to help lower their cholesterol because we're just not comfortable putting them on a statin. And for me, as far as business, it was the perfect time. We were facing Medicare cuts in my husband's practice. My children are grown, and it was a perfect time for me to transition from being a PTA mom to being a businesswoman.